There is a rich future for CAR T, and I could probably talk for hours on this, but I'm going to try to break it down into a few categories of where I see CAR T therapy immediately going. So definitely trying to identify the patients that are not going to benefit from chemotherapy, transplant, all that right off the bat. We are already moving in the direction of saying we are going to sign those patients up or kind of channel them down a CAR T route much sooner than we've traditionally done. So that's one area of progress for sure. The second is this idea of using off-the-shelf CAR T cells. So saying I don't have to wait for a manufacturing slot. I don't have to wait three to 4 weeks for these cells to come back to the patient. One thing we didn't even talk about yet is that unfortunately some of these products do fail manufacturing, and that can be because these T cells that have been through chemotherapy after chemotherapy are literally beat up. And so for those patients that fail, we're sitting there waiting to get these back, and then we learn, oh, by the way, you're not getting these cells back. If we had cells that were already on the shelf, kind of ready to take and prescribe to this patient, that would help outcomes quite a bit. The other exciting thing that's being done is, specifically in the field of B-cell lymphomas and leukemias, unfortunately, the CAR T is not going to work for everybody, and we do think some of the reasons these CAR T fails might be because there's only one protein that we're attacking on the surface of the cancer cell. So they're starting to look at, can we engineer these T cells to attack more than one protein, and that way if one mechanism fails, we kind of have the backup or the secondary mechanism. So that's been really exciting, and we've heard some preliminary data on that. And then finally, these are T cells that are being grown in a laboratory, but we know the immune system is very sophisticated. And so the question is, how do we use our knowledge and get those T cells to grow to higher numbers, to grow in a way that they work differently? And so one of the things that's being done is basically when these cells are being cultured, they're kind of changing the bath that these cells are growing in. They're stimulating them in different ways to say, when these come back and go into the patient, can they work differently then? So that's just a small snapshot of where the field is going. I think these CAR T cells are being looked at in many cancers, both blood cancers and non-blood cancers, to see, can we use this therapy of kind of igniting or manipulating the immune system to attack a broader range of cancers.